When a person has a sudden cardiac arrest, the actions of bystanders save lives. In the UK, 30,000 people experience a sudden cardiac arrest each year.
By recognising cardiac arrest, calling for help, performing chest compressions and using a public access defibrillator, members of the public can double or even triple a person's chance of surviving. Every minute without your help reduces this chance.
This video will teach you how to identify and respond to a cardiac arrest safely using the updated guidelines from the Resuscitation Council in light of the coronavirus pandemic. We'll also show you where on campus you can find a defibrillator and how to use it. So whether you're new or returning to campus, this next few minutes could help you save a life while keeping yourself safe. The key steps to remember are to recognize cardiac arrests and call for help, perform chest compressions with minimal interruptions, find and apply a public access defibrillator, follow its instructions.
If you find someone who has collapsed and is not breathing normally, make sure it is safe for you to approach. Shake and shout to check for a response. If they are unresponsive, your first priority is to call for help. If there are other people nearby, ask them to call 999 and fetch the nearest public access defibrillator. If you are alone, call 999 and put your phone on loudspeaker so you can speak to the ambulance service while assessing the person. On campus, you should also contact university security, who will attend to assist you and liaise with Yorkshire Ambulance Service to direct them to your location. Now, check for breathing. Do not put your face close to theirs. Instead, place a hand on the chest to look and feel for breathing. If they are not breathing, or their breathing is very abnormal, then they're in cardiac arrest. You do not need to give mouth-to-mouth, but starting chest compressions may help save their life. First, cover their nose and mouth with a face mask or towel. This will reduce the risk of virus transmission. Do not use anything that could damage the face or block the airway. Now, expose the patient's chest as best you can. Place your interlocked hands in the center of their chest and push hard and fast. To give effective chest compressions, push 100 to 120 times per minute. Compress 5 to 6 centimeters and ensure the chest recoils between each compression. Do not worry about hurting the person by giving chest compressions. You are taking over the heart's job of pumping blood to the brain, providing it with oxygen until further help arrives. Continue CPR until further help arrives, or the person displays obvious signs of life. Chest compressions are tiring if you're doing them effectively, so try to swap with other bystanders every couple of minutes to maintain the right speed and depth. Whilst doing this, keep interruptions to an absolute minimum. When the ambulance arrives, do not stop CPR until the paramedics are ready to take over. As soon as someone arrives with a defibrillator, turn it on and follow the instructions. Public access defibrillators are fully automated and can be used by anyone with little or no training. The machine will tell you to apply pads to the person's chest and then stand clear while it analyses the heart rhythm. The defibrillator will determine whether an electric shock is required to try and restart the heart. If a shock is required, some defibrillators will instruct you to press a flashing button. Others will deliver the shock automatically after warning you with a countdown. Either way, check everyone is standing clear before the shock is given, and restart chest compressions immediately afterwards. The defibrillator will then reassess the heart every 2 minutes. The defibrillator won't let you deliver a shock unless it's absolutely needed, and every minute counts.
There are 30 public access defibrillators across the university, as well as devices in public places across Hyde Park, Headingley and the city centre.
To unlock the defibrillator cabinet, you may need a combination code. This can be obtained by calling 999. This also ensures further help is on its way. Do you know the location of your nearest public access defibrillator at home or on campus? Visit the university's online campus map to find the nearest defibrillator on campus and download the Save a Life app to view defibrillator locations across Yorkshire.
By following these simple instructions, you can help save a life while keeping yourself safe in the coronavirus pandemic. Remember, when someone experiences a sudden cardiac arrest, it's the actions of bystanders that make the biggest difference to their survival.
If you'd like more information so that you can become a campus lifesaver, you can sign up via the link below for an online training session which will use new technology to provide hands-on practice and feedback. Get hands-on, share this video, help save lives.